Hi, I'm going to be going over the second portion of the IV, which is the Piggy Back. So I still have Jake here. I've already set up his primary IV line. I'm going to be administering him um, some antibiotics for his pneumonia that he has. So I've already been in here. I checked Jake's name, verified it, allergies, doctor's orders, any allergies. So I am currently still in the same room, and I'm just now getting to my second bag that I'm going to be hanging up per doctor's orders. You can see that the bag is still infusing for the doctor's orders, so we have that. So I'm going to be looking at the orders here. So the doctor does want the bag changed, and we're going to be using ceftriaxone, uh, 1 gram every 24 hours for pneumonia. And this is what we have right here. So we're looking at that. And I also put a linen saver down too. I will be using this later, but I have it down here. So I'm going to tell you a little bit about ceftriaxone. Before I do, I'm going to be looking at signs around the IV catheter area. So first sign I'm going to be looking for is phlebitis, which is red, swelling, warm to touch, and almost feels like a knot, like it's hard, and painful. So I don't see any signs of that. Other signs I'd look for is infiltration, which would be a cool touch, paler, and the best way to check it, and probably some swelling too as well, because essentially what happened is the IV came out of the vein, so then now it's just spreading into the tissues. So the best way to look for it on any person, especially geriatric patients, is looking underneath the arm here. So it normally ends up pooling up underneath there. So I'm going to be telling you about ceftriaxone. The trade name is Roxafen. It is a third generation cephalosporins. The therapeutic is anti-infectives. They use the skin and skin structure infections, bone and joint infections, UTIs, gynecological infections, lower respiratory infections, which is pneumonia. So that's what we're treating with Jake today. The action, it binds to the bacterial cell wall membrane, causing cell death. The therapeutic portion of it is the bactericidal action against susceptible bacteria. For any precautions, we're going to be looking for hypersensitivity to any cephalosporins, and also for hypersensitivity to penicillins. Jacob is not on any penicillin right now, so I'm not worried about that. Side effects of the medication is seizures, C. diff, which is associated with diarrhea, gallbladder sludging, pancreatitis, and anaphylaxis. Interactions, it may increase the risk of bleeding with warfarin, and it should not be administered with any calcium solutions. So Jake has no warfarin or calcium solutions going into him at this time. So I'm not worried about doing giving this medication to him at this time. The route is going to be by IV, and they state that it's 1 to 2 grams every 12 to 24 hours for most infections, and do not exceed 2 grams per day. You assess the infection, like I said, the phlebitis and also the infiltration, the vital signs, blood pressure, signs of any anaphylaxis, which is a rash, laryngeal edema, wheezing. If that's there, stop the IV and consult the doctor. Also, along with monitoring their bowel movements, their functions of that, and diarrhea, abdominal cramping, fever, bloody stool, stop the IV and contact the physician. With lab, it may up the serum of AST, ALT, alkaline phosphate, bun, and creatine. So I did check with the ceftriaxone, and if it is compatible with sodium chloride, and it is. So I am comfortable with giving this medication, the ceftriaxone, to Jake since I have looked over the medication. I did my math prior, so I have 1 gram here of ceftriaxone. So it would be 12.5 drops per minute, and then I divided it into 4, because there's 4 quarters a minute, and it'd be 3 drops every 15 seconds. So let's put this over here. So I have my doctor's orders and my MAR. So first thing I'm going to be doing, checking my medications. That's all right. Okay, so I have this here. So this is going to be my first check. So I'm looking at this. I have ceftriaxone 1 gram, not expired, no discoloration, has not been open. So ceftriaxone 1 gram by IV every 24 hours for pneumonia. That's what we have in the MAR and that. So, and then I'm going to be doing the second check. So ceftriaxone 1 gram IV every 24 hours for pneumonia. That's correct. The 5 rights of medication administration is right patient, right drug, right dose, right route, and right time. So the route of this is going to be through IV. So on to my third check. So I have ceftriaxone 1 gram. The doctor's calling for it to be given by IV every 24 hours for pneumonia. So my medication is okay. It is not expired. So that's good. Next, I'm going to be checking the packaging of my secondary medication set. For the sake of the video, this package has not been opened. It has not been tampered with. None of the tubing is discolored. And it's not expired, so I will be using this. So, we're taking these. I'm going to wash my hands and start setting up the IVs. And I'm not using any sterile gloves. I just, the only thing I will be doing is just setting up my everything with just clean gloves. So first thing I'm going to do is I'm going to open up my package here. So I have my tubing in here along with this blue hanger. I'm going to take this out of here right now. Keep the tubing in here. I'm going to take this out, and this is going to be hanging from here. So I'm just going to switch this right now. Here. And hanging it back up here. So I have that now. Then I'm going to be taking out my tubing. So this is the sharp end of it. I'm going to be taking that and putting it into this port right here. So I'll be very careful to not touch the ends. So taking that one off. The end, be careful with that. And then it's going to go thumb to thumb. Thumb to thumb. That's why we do it like that. So twist and push on there, and now we got it on there. So I'm going to also make sure that I have my tubing clamped. We don't need this running all over the place. So I do have that clamped. Now I'm going to be hanging this one above the primary bag. That right there. My next step is I'm going to be actually cleaning the port closest to the primary bag and connecting the secondary bag to the primary. So I'm going to be taking the alcohol wipe, and here's the closest port, which is primary bag. And I would clean this really well in circular motion for 30 seconds. And for the sake of the video, it's been 30 seconds. So I'm holding on to this, and I'm going to be taking this tubing off here. Same thing, not touching the ends. Comes like this. Together it's going to be a push and twist. So that's all set up now as well. So we already had this one infusing. Now I'm going to take this Piggy Back one, and I'm going to drop it lower than this because I want to fill this halfway. So I am going to now be taking my clamp, and I'm going to be opening it now. So I can be infusing that. So we are halfway through here, so that's perfect. So I will hang that back up. All right. So the next thing I'm going to be doing now is I am going to be opening it up and getting my 3 drips per 15 seconds, or 12.5 drips per minute. So now I'm going to be opening up the primary line, and then I have this open. Alright, no. Perfect. So it is 3 drops every 15 per 15 seconds. So I have that running now. And what I would do is I would label my bag. This is what I changed out. So with the date, time, and my initials, that way they know who did it, and also the tubing as well. So name, date, time, and initials. So I don't know, just move it around here. And then I would just ask Jake, is there anything else that you need? I do have time. He would say no, and I would go and document. For the other half of this, so if I'm going to be removing his line, say I come in and we're good, the doctor wants us to remove it, and Jake will be discharged, I'm going to end up closing up the clamps on here on both IVs. So both of them are now clamped. And I am then going to be taking off the dressing around the IV. And I'm going to be taking off the IV here. So with gloves on. All of that untaped. So what I'm going to do before I take it off, I'm going to clean this area between the IV and the skin for about 15 seconds. So it's been 15 seconds. Take this off. I'm going to take a 2x2 and I'm going to place it on top of the IV catheter. I'm not going to be putting any pressure on it. And then I would be taking the IV out, and then at that time, once it's out, I'm applying pressure to it. They say 1 to 3 minutes. I would be holding it for about 2 minutes. So 2 minutes has passed. I would then switch out this gauze for a new piece of gauze, put this down, and take this up here. Do it this way. Easier. now I have that all taped up, pressure is being applied to it, and at this time, the IV is also out of it as well. So I would just then be asking, Jake, is there anything else that I can do for you? I do have time. He would say no. And then I would go and document